Hi, my name is Dr. Burnali Bhattacharya. I'm a consultant pediatrician, and because I'm a pediatrician, I see a lot of infection. And because my area of special interest is respiratory, so I am getting asked a lot of questions about the new bug, which has scared the world, because the new bug, that's the human metapneumovirus, has again surfaced in China, and we saw what COVID-19 did to the world. It flattened the world, and it took us pretty many years to limp back to normal life. But the human metapneumovirus has been around for a fairly long time. A lot of us may have already suffered from it. Only if it is in the extreme of ages, that is very young babies and adults beyond the age of 65, when you can land up with pneumonia with a bad human metapneumovirus infection. Otherwise, it would be just like a flu, that is runny nose, sneezing, itchy throat or pain in throat, low-grade fever, body ache. So don't be scared, but what can you do? Again, be careful about touching surfaces. Get back to washing your hands well, which you may have forgotten, which we were doing during the COVID-19 pandemic. Again, if you're going into crowded places, it may be worthwhile to wear the mask. It would be good to avoid people who are ill, and if you are ill, if you are suffering with cold, cough, fever, please don't go to work. Please don't send your child to school. Stop the bug from spreading. Can you do any selective test for human metapneumovirus? The answer is no. As part of the biofire, where you can find out different viruses, if you do a respiratory test for the bugs, you might get metapneumovirus. But is there any treatment? No, there is no antiviral specifically for it. So if you are suffering from these symptoms, you have to just treat it like a normal flu. Rest, plenty of oral fluids, stay away from people, and drink a lot of fluids. Keep yourself well hydrated, and you can take paracetamol if you have fever and body ache, and keep a track on your temperature record. And if you're worried, meet your doctor, but don't panic, and don't let this panic kind of take over your life, or don't make it the topic of discussion everywhere. So your doctors will guide you about what is human metapneumovirus. Whatever questions you have, ask your doctor. Bye. Thank you.